So we have started a series of videos on scores in stroke. I already make a video on intracranial bleed in which we have to find intra-ICH score, and in subarachnoid hemorrhage we are going to find HNH and MFS. Today we are going to talk about the TIA, I mean the transient ischemic attack. We have to find the ABCD2 score, and in ischemic stroke we find NIHS score. So today we are going to talk about TIA, transient ischemic attack, and the score. A is for age. If age is more than 60, the score is 1. If BP is more than equal to 140/90, the score is 1. From this C we can say clinical feature. If only unilateral weakness, the score will be 2. And if there is speech disturbance without weakness, the score is 1. From this D we can say duration. So if the duration is more than 60 minutes or more than 1 hour, the score will be 2. And if the duration of this clinical feature is 10 minutes to 59 minutes, that will be 1. If the patient is already having diabetes mellitus, so the score will be 1. Now if you see my book, The Resident Physician, I already explained this transient ischemic attack and this ABCD2 score. Now there are two significance of this ABCD2 score. The one, it will give you the risk, the percentage of risk of stroke in this patient. The second, by this score you have to decide, are you going to give the dual antiplatelet to the patient or single antiplatelet to the patient. So I received a patient with a 65-year-old male patient, known case of hypertension, was presented to us with left side weakness, which was recovered within 55 minutes. On examination, the patient GCS was 15/15, fibular bilateral equal and reactive, power 5/5 in all four limbs. Cerebral sign of this patient was negative, and frontal bilateral downgoing. We did CT brain, and that was grossly unremarkable. Vitally, the patient BP was 145/95 mmHg. Now, as this patient was having unilateral weakness and which was recovered within 55 minutes, we diagnosed this patient with transient ischemic attack. Now we have to find ABCD2 score. Now for this age of this patient is 65, and if the age is more than 60, the score will be 1. Here the age is 65, the score is 1. Now the BP of this patient is 145/95 mmHg. Now, as I already know, if the blood pressure of the patient is more than equal 140/90, the score will be 1. So I will give 1 score here. Now this patient, from this C clinical feature. On clinical feature, the patient were only having left side weakness. So this is unilateral weakness. For unilateral weakness, the score is 2. If you guys can see here, the unilateral weakness, the score is 2. Now this patient duration of this clinical feature was 55 minutes. And that is less than 1 hour, so the score will be 1. Like if you guys can see here, if the duration is from 10 minutes to 59 minutes, the score is 1. And this patient doesn't have diabetes, so the score is 0. Now 1, 2 and 2, 4, and this one 5. So the ABCD2 score for this patient was 5, and this patient having high risk for stroke. If the patient ABCD2 score is equal or more than 4, that is mean high risk patient. If you guys can see here, low risk patient if the ABCD2 score less than 4. High risk patient, the ABCD2 score more than or equal to 4. You have to admit this patient because this patient is having high risk or chances of this in coming time the patient will be having a stroke. Now from this ABCD2 score, one thing it tells us that the risk of the stroke, and second we have to decide the antiplatelet. For this patient is high risk patient. So high risk patient, as I already told, that if the ABCD2 score more than or equal to 4, that will be high risk. For high risk patient, you have to give dual antiplatelet. For low risk patient, you can give single antiplatelet. For example, if the score is more than equal to 4, that is high risk. For this we will give low plate plus 75/75. And if the patient having low risk patient, ABCD2 score less than 4, then we can give single Loprin aspirin 75 mg. So I advised low plate plus 75/75. This because this patient was having a 5 score, which is a high risk, so I gave dual antiplatelet. And I also give statin lefigate 20 mg ODHS. And I advised, as we have to rule out why this patient were having TIA, so we will do 2D echo 24-hour Holter monitoring, carotid Doppler, and then we will review this patient after 2 weeks. But with a score 5, you have to admit the patient, you have to observe for at least 24 hours this patient and complete this investigation and started the patient on dual antiplatelet. So you have to remember the two significance of ABCD2 score. One is tell us the risk of the stroke of this patient, and another we have to decide that either we should give dual antiplatelet or single antiplatelet. For high risk, which means that ABCD2 score are equal or more than 4, we will give dual antiplatelet. If ABCD score is less than 4, we will give single antiplatelet. Thank you.